Yes,
Yes,
ma'am.
madam, it's audible.
Yes, ma'am. Yes, ma'am.
Okay. Today, I am going to talk to you about the post-COVID status of human resources and organization development interventions in select private hospitals in Karnataka. Now, let me tell you why this, the rationale behind a study like this that I did as late as I am in 60 years of age. You see, most of us, teaching, management, or commerce need to have some practical insight into business, some practical insight into how an organization works, because anything theory children can read today. But what we need to do is to focus on the practicalities. That is of utmost use to the students. But unfortunately, we would have done our post graduation, then we would have done the qualifying examinations necessary to take up eligibility for teaching, and straight away we would have gone into teaching. And there, there is a gap, there is a lacuna. So, my one suggestion to all my brethren here in the teaching fraternity is whenever you get an opportunity, please make it a point to take up some kind of a study or an internship or some kind of practical exposure wherever it's possible in your own field of specialization. Maybe if you're at teaching taxation, then working with a tax practitioner or a chartered accountant will do a lot good for you to share your share the learnings in classroom. So also for teachers of management, having an insight into the working of an organization is always helpful to bring in to the classroom the field activity or the firm activities. So, with this passionate interest, I had done a study for all manufacturing industries. I had done a study on HR and OD intervention mechanisms way back, some almost about 30 years back, 3 decades back. I had done a study, and I was always passionate of doing this study for service industry. And then when it came to doing in a service industry, I preferred doing it for a hospital because I wanted to do on a subject that is very contemporary. And what could have been more contemporary than post-COVID? So I with that passionate background, and moreover, I was in the industry. I had practical experience of working in HR department. So I thought, why not do this study? Therefore, very recently, I completed this study, the study on that is the post-COVID status of human resources and organizational development interventions of select private hospitals in Karnataka. You see, the hospitals and their services have touched all of our lives. We were all impacted by COVID-19. Compassion and care were the hallmarks of the hospital workforce. And at the center of this compassion stands the hospital staff that constitutes a rich community of professions with varied backgrounds and experiences. We have doctors, nurses, paramedics, so many in the supply chain management of medicines and medical equipments and so on and so forth. So COVID-19 crisis, further, this COVID-19 crisis changed the world of work with unprecedented demands at a pace that we have never imagined. Now, this is it also showed that there is a growing evidence or link between implementation of HROD interventions with workforce satisfaction, with staff engagement, with their well-being, and also patient care quality. So the human resource and organization development professionals play a very significant role in designing and implementing the HROD interventions for realizing, I must say, measurable improvements, as also sustainable growth by focusing on all aspects of people agenda in hospitals. Knowing that their contribution is vital in enhancing the hospital's visibility, vibrancy, and resourcefulness, it is imperative to examine the effectiveness of their role. Therefore, I thought this would be a very, very suitable topic. Now, before I actually go into, the study per se, let me just throw some light onto a few concepts. Otherwise, I know that all of you do not come from the HR background per se. You have uh, relatively, you have had some knowledge maybe as a paper through, in the process of your study. Some may not even have had exposure to some of these HR concepts. Therefore, conceptualization actually provides what? It gives you an insight into key concepts. So it is a description particularly of the terms. Now here I'm only going to give you operational definitions of a few terms that I would be very, very frequently using. Now, what is this concept called OD? You see, organizational development is primarily a strategy which is aimed at improving processes. Now, when I say it is a process for improving processes, I'm trying to say that it's a strategy for change that is aimed at bringing about improvement within the organization's capability in a very planned and structured manner. How does it do that? By continuously seeking to ensure that the organization adapts itself to the changing environment. Therefore, organization development per se engages the organizational members in identifying, diagnosing, choosing the right interventions, assessing the results, and their outcomes. So, the focus of change is the organization as a system and its recognizable subsystems. So, this is the basic definition if you have to go about OD. Therefore, OD, I must tell you, is a very, very powerful change strategy with its distinctive features of being participative, collaborative, resolving problems, and also unearthing opportunities for development. Now, when we talk about OD interventions, here we are talking about interventions for human processes, which could be individualistic, it could be dyadic, that means between two individuals, it could be group interventions, it could be team interventions, it could be intergroup interventions, which primarily addresses improvement in communication inside the organization. Then the interventions may be for technology and structure. Now, these are focused towards technological and structural aspects such as the organizational design, staff engagement, job redesign, total quality management, job enrichment, and so forth. And then there are interventions for managing human resource, which we call as HR interventions. And their target areas are on performance management, training and development, that is potential development of talent, diversity, wellness interventions within the organizations. And further, we could see that there could be strategic change interventions. Now, this would encompass continuity in change, paradigmatic change through transformation. So, organization development impact numerous facets, number of facets. And for change to be successful, you know that OD requires employee involvement in all facets of the organization's hierarchy. OD interventions are cyclical in nature. They need, they need, they work towards the need for improvisation, diagnosis of the problem, devising interventions, assessing their performance, discovering solutions, and benchmarking with scope for continued learning. So this is as far as OD interventions goes. I already spoke to you about human resource interventions. So the human resource management interventions primarily focus on managing the individual. Here, when I say individual, I'm talking about the employee. Its objective again is to enhance the organizational efficiency and performance of the employees. It could be from entry to exit. So it encompasses everything to do with employee development, reward management, employee benefits, talent management, then workplace safety and stationary compliance. So next comes the term organizational transformation. Now, when change programs are initiated in the organization, it will result in revolutionary. When it results in revolutionary, all encompassing, dramatic, radical, quintessential change, then we refer it to as organizational transformation. Andre, organizational transformation takes place when there is change in all the 7S, McKinsey 7S model map. When the change happens in all the 7S, Andre, I hope to remember, let me see, the shared vision, the structure, the system, the staff, the strategies, then you see the I think more or less I covered them. So all these 7S, the hardest and the softest, all of them included. When the change is seen in all the 7S, then we see transformation taking place. So it's a planned organizational transformation results because of a planned change intervention that can be categorized into two levels. One is the structural change, and the other is the OD, which could be either traditional and revolutionary, or it could be, as I told you, the change could be revolutionary. So, organizational transformation would account for breakthrough changes in technology, organizational external environment, and these changes demonstrate significant consequences in the business strategy of the firm. That results in the need for strengthening corporate culture, reworking on the processes, reconfiguring the structures to support all-round change. So such fundamental change necessitates a newer direction for perceiving, thinking, and behaving in organizations. Now, with this background of some of the operational definitions, let me go into what was the research gap. The COVID-19 crisis has affected organizational change practice, such as how hospital workforce is managed, and how organizational changes are embraced in healthcare delivery institutions. Personnel ranging from, say, specialists to paramedics, all of them, nurses, everybody, are grappling with the need and the pressure for change to adapt to the new reality. So the HR department must leverage its knowledge of the HR challenges faced, hospital staff satisfaction, implementation effectiveness of HR and OD interventions, transformational initiatives that create an impact on the sustenance of hospitals, and benchmark practices of successful institutions. See, so the HR department must leverage its knowledge of facing, ನಾನು ಇದನ್ನೆಲ್ಲ ಕವರ್ ಮಾಡಿದ್ದೀನಿ as my scope of study, facing HR challenges, hospital staff satisfaction, surveying on that, implementing effectiveness of HR OD interventions, the satisfaction surveys, transformational initiatives taken by the hospitals, and benchmark practices with successful institutions. So it is very, very imperative for hospitals to essentially visualize the database through pre and post COVID assessment. See, I cannot talk about post COVID status until and unless pre COVID pre-COVID assessments too are simultaneously made. So the statement of the problem was that COVID-19 crisis has posed a challenge to the traditional HR and OD practices that hospitals once followed that may not be fully adequate during this challenging period. Hangandre nanu ಹೇಳ್ತಾ ಇರೋದು, it's not that it's not required at all, or it needs to be completely revamped. And what I'm saying is, its current practices are not adequate enough, or the intensity of driving these practices are not adequate enough to challenge the period. So a relatively new adaptive system offers promise for addressing the exceptional crisis conditions that these private hospitals are facing in the post-COVID-19 era. You may ask me why this reason of going for private hospitals. The reason was very clear. It is impossible to get data from government hospitals. Rather, very, very difficult. Given a short span that I had at my disposal, what was possible was for me to go to private hospitals, multi-specialty hospitals to get data. And therefore, I chose the private hospitals. So it is required for hospitals to conduct constant survey for assessment of satisfaction levels of staff, patients, on what? On HRD, or rather HR and OD practices. How effective is their implementation? What is the ongoing experimentation? What has been the reflection and learning which has been shown through a transformational role of these HR and OD interventions during pre and post-COVID periods. So what I did, I restricted my study to about, 5 or 6 objectives. One was I wanted to have a first-hand feel of what the doctors, nurses, the paramedics, the consultants, what do they see as a challenge, HR challenge in the private hospitals. So what I did was I used open-ended questions, and using that, I did a thematic analysis. So this was my first objective. The second objective was to analyze and compare pre and post-COVID satisfaction levels of the hospital staff. So all the 4 categories of hospital staff I have considered: doctors, nurses, paramedics, and HR professionals in the hospitals. The third objective was to see the satisfaction level of patient care quality during the post-COVID scenario. The fourth objective was to analyze the perception of the HR/OD professionals themselves about what they saw or what they perceived as effective implementation of HR/OD interventions during this pre and post-COVID. What they themselves felt, because they were the drivers and the deliverers of the system. What is their take on it? And then I tried to examine the transformational interventions that were undertaken by the private hospital staff, by the private hospitals during the post-COVID. And in the afternoon class, I will cover this. I practiced benchmark these HR/OD interventions with those that were prevalent in the GP surgeries in the United Kingdom, and came out with a few suggestions on appropriate interventions that these private hospitals in Karnataka could adapt. Now, the scope of my study was restricted to 10 private multi-speciality hospitals in Bangalore, Mysore region. And the respondents of this, I covered, of course, every multi-speciality hospital here in Karnataka, and a few from Bangalore: Narayana Hrudayalaya, Apollo Hospital, Kamakshi Hospital, Sigma Hospital, Gopal Gowda Hospital. And from Bangalore, I did Fortis Hospital and Wakad. And again here in Mysore, Suyog Hospital, the JSS Hospital. So about 10 hospitals. The respondents for the study included the patients and the hospital staff. So Hospital staff andaga, I categorized them, segmented them as doctors, HR professionals in hospitals, paramedical staff, and the nurses. So the study addresses, I have already told you in my objectives what it covers, what is the scope of my study. And very clearly, this study that I made was a collective representation of private hospitals, and in no way did it dwell on individual hospitals or comparative analysis amongst hospitals, because very clearly I had signed a non disclosure agreement. So, for the purpose of practice benchmark, which I did in the UK, I took up 10 GP surgeries, 3 from Birmingham, 3 from Gillingham, 1 each from Chatham, Rainham, Rochester, and Maidstone. So, this in the afternoon session I would be covering. For now, I will only restrict it to the study that I have made in the private hospitals in Karnataka. The research methodology I used was applied, exploratory, and descriptive, deductive and inferential in the study, the approach. It was a survey oriented approach, and I used both quantitative and qualitative research methods. My sample unit were the hospital staff, that is doctors, nurses, paramedics, and HR professionals, and patients. The sampling technique that I used was proportionate simple with stratified sampling technique. The sample size that was required as per calculations was 384, and while I took about 402 of the hospital staff and 385 patients. Of course, there again, of the hospital staff, I took 135 doctors, 123 nurses, about 114 paramedics, and 30 HR OD professionals in full, in total population. I used the data collection instruments were, of course, structured questionnaires consisting of closed and open-ended questions. I used Google Forms. The qualitative study that I used was based on thematic analysis, and the quantitative analysis, of course, I did a reliability and a validity test, did descriptive statistics, mean, standard deviation, and coefficient of variation. I did an exploratory factor analysis test by principal component analysis. I used hypothesis testing using the paired sample t-test, and then the chi-square test. Now, I will go objective wise. I will just take you through the discussion without doing much about any statistical treatment here. So, the first objective I said was to examine the post-COVID human resource challenges in private hospitals. I was, I did that. The findings were based primarily on thematic analysis. Now, if you were to ask me what is a thematic analysis, it is a exploratory research giving you inferential details. The process involved in thematic analysis and the steps undertaken includes listing the broader themes and examining the data, reflecting on the coding process, searching for themes that reflect a pattern, discovering the subthemes, re-examining the classification of the themes, then refining them, and finally explaining the themes in depth as to what they imply to the research questions. Following this method, I arrived at the following uh, inference. Employee well-being. See, here let me tell you, amongst this, let me just tell you, take you through what were the themes that finally I came across. There were employee well-being concerns, flexibility of work, adapting to new technology, human capital loss, HRD processes, leadership, performance, and internal communication. These were the 8 themes that it was classified. And it was found that employee well-being concerns are perceived as a major HR challenge by all 4 strata of hospital staff, that is doctors, HR OD professionals, paramedicals, and nurses. In fact, the concept of well-being culture evolved with COVID. Another challenge seen by nurses and the paramedics and the HRs themselves is the internal communication. And then the changing work pattern and work methods is also seen as a major challenge by the HR professionals. Both the qualitative and quantitative study showed satisfaction towards the HROD interventions in hospitals. Aligning with the findings of this qualitative study, the hypothesis test results discussed also showed significant difference between the satisfaction amongst hospital staff towards HROD interventions in pre and post COVID-19 at 5% level of significance. Now, employee well-being concern is a challenge, reason being mental health and well-being of hospital staff is much affected by shift in work culture due to the pandemic. And employee wellness concerns are critical and challenging due to high volatility of the external and internal environment during that period. They were changing paradigms, unstable behavioral pattern of employees in the post-pandemic period. The role of HR also there had broadened in every with every possible strategic initiative. Employee wellness interventions are focused, were given more focus because it was more to do with physical health of the employees, which are attended by the hospitals in any case. But the employee well-being interventions were seen to be very important because it is more holistic and broader in approach and includes mental and emotional wellness. Therefore, the opinion of the staff was that it needed to be strengthened in hospital. Well-being more than just wellness. Wellness has got to do with the physical condition, whereas well-being is got to do with along with physical, the mental and emotional wellness. Then another finding was that internal communication, as I told you, plays the most critical role, which is required to be seamlessly woven between administrators, specialists, consultants, nurses, paramedics, medics, up to the housekeeping staff, as the working hours of the hospitals are 24 by 7, all days in a year, and the employees too reporting are at different times around the clock in different shifts. So, irrespective of the role or cadre they belong to, communication was seen as a challenge by the employees. Employee well-being and internal communication was not seemingly visible in the quantitative study, which was possible to be unearthed through thematic analysis. Therefore, we also need to somewhere do a cross study in order that we are able to unearth some hidden aspects. So that was done through qualitative study. And then HR professionals, another challenge, faced extraordinary difficulties in streamlining communication routes that is needed to keep the functions ever active. Identifying urgent and non-urgent medical needs and redesigning flows and redirecting the needs were quintessential to be proactive. Closer communication between hospitals and vendors and other intermediaries in the supply chain had to be established. The challenge of internal communication here is with respect to coordination, transparency, and timely dissemination of information, whereas the implementation of communication intervention addressing information sharing on HR policies were found to be proper. So, implementation wise, they were more accurate. People were satisfied as per the quantitative study. But what required beyond this was a greater element of coordination, transparency, and timely dissemination, which was why it was considered as another challenge. Then HR professionals also faced extraordinary impediments due to COVID-19, compelling them to change work patterns and work methods. So implementing change initiative had been a Herculean task for the HR team as a whole, whose outcomes would take time to get demonstrated. Nurses and paramedics opined that they lack the motivation. Their interest is to enhance their competency through training, and that their work under high pressure restrained them from undergoing any training. So the quantitative study also aligns in its result with acceptance of null hypothesis on both individual development interventions and learning and behavioral interventions. There was greater willingness on the part of the employees across occupation to reorient, learn, and adapt to new technology. So the eagerness to step up was seen to be proactive in majority of them, excepting a few laggards, resulting in frustration due to lack of opportunity. This is as far as the what the challenges were concerned, and what the nurses opined. See, the doctors amongst all employees in my survey were the people who were most vocal and emphatic about the reasons that have led to human capital loss and the managerial implications of not addressing these. So a part of the blame game was rooted at leadership for lack of clarity in strategic direction and safety leadership. They believed that it was a leadership crisis during the COVID crisis. The result clearly reflects that the private hospitals have been focusing on HR's adaptation of strategies both during pre and post COVID. So it is a fact, agreeable fact, that in both pre and post COVID there have been HR strategies and a few OD interventions that were being implemented. They were being accepted as satisfied, but it is more effective. What the study says is it was more effective during the post-COVID period. Aligning with the findings of the qualitative study, the hypothesis test results show significant difference in the perception amongst hospital staff towards implementation of HROD interventions in pre and post COVID-19 at 5% level of significance. Now, coming to the second objective of analyzing and comparing pre and post COVID satisfaction levels of hospital staff in HR on HR and OD interventions. Now, here, let me tell you what were the aspects that I covered when I took up this, implementation aspects. I covered the overview of HR implementations, work environment, appraisal and reward, communication, work environment, integration, productivity management, growth and development, vision, and employee expectations. These were the satisfaction levels were with respect to all of these things, and I had classified these headings under which I made the study. So, what were the hypotheses that I tested? The null hypothesis that went for test was there is no significant difference between the satisfaction amongst private hospital staff towards HR and OD interventions in pre and post COVID-19. With a p-value of 0.001, the null hypothesis was not accepted. So I also did the testing of sub-hypothesis for doctors, for HR professionals, for paramedics, and for nursing staff. So I had 4 sub-hypotheses. In all these cases, I found that the p-value was 0.001, and therefore the result showed it was not accepted. The null hypothesis was not accepted. Then, let me, going by, it was observed also further that the mean value of post-COVID-19 is greater than the mean value of pre-COVID-19, indicating that there exists greater effectiveness in the implementation of HROD interventions during post-COVID-19. All the classified parameters showed higher mean values consistently, indicating that the HROD initiatives have been intensified during post-COVID-19. It is further observed that in terms of opportunities for growth and development of employees in post-COVID, the doctors in particular have relatively lower value in cross-functioning than pre-COVID-19, as regulations in post-COVID became more stringent, with services required to be offered only by respective specialists. As a result, their exposure to cross-functioning is limited as compared to pre-COVID-19. Further, it is observed that HROD professionals have greater satisfaction in terms of implementation of HROD interventions during post-COVID-19 than that of pre-COVID-19. So, in terms of satisfaction levels, also in terms of implementation effectiveness levels as well, the pre-COVID status seemed to be far better. In case of nurses, their satisfaction levels with the support received by HROD team is more in post-COVID than that of pre-COVID-19. Coming to the third objective, that is to analyze the satisfaction levels of patient care quality in post-COVID scenario. The hypothesis that was tested was the null hypothesis. Perception of patients do not vary towards care quality in post-COVID. Here also, that the p-value was less than 0.001, which was not accepted. Now, what is the implication of this? The feedback from the inpatients of private hospitals is positive in terms of the overall care quality, with specific reference to the patients being educated by doctors about their illness, about the cleanliness, about the interdepartmental coordination and cooperation across the hierarchy, and fulfilled expectation of treatment and medical care. The other elements adding to their satisfaction are housekeeping and hassle-free admission procedure. However, patients did have some grouses when it came to nurse care and hospital food. In their opinion, this should have been even better. Therefore, private hospitals need to pay greater attention to hygiene and quality of food with mandatory rules. Nurse care is crucial in patient care quality. Although nursing care is moderately good, the statistics do not show that it is bad. Although it is moderately good, more time, patience, tolerance, precision, and concern can be displayed by the nurses. So, focus should be on building nursing staff capacity by redesigning and redirecting the flow of nursing services to provide better patient care. Coming to my fourth objective, it was to analyze the perception of HROD professionals by themselves on the effectiveness of their implementation during pre and post COVID. Implementation of what? HR and OD interventions. To our surprise, now what were the aspects, let me tell you, that I tried to cover when I spoke about implementation effectiveness. One was managing people. The second was on recruitment. The third was on performance management. Fourth on training and development. Fifth on appraisal and reward. And the sixth was on organizational exit. The null hypothesis, with more or less, or in all respects, it was less than 0.05. 0.05, yes, less than 0.05, and in all these cases, the null hypothesis was not accepted, except on the hypothesis There is no significant difference between the perception of HROD professionals towards the effectiveness in the process of performance management in pre and post COVID period. Let's look at this. On the perception of the effectiveness of overall implementation of HROD interventions, it is observed that the standard deviation during pre-COVID is higher than post-COVID-19, indicating that HR professionals are divided in their perception during pre-COVID, whereas HROD professionals are confined in their attributes in the overall implementation of OD and HR interventions in post-COVID-19 scenarios. This is justified by coefficient of variation, where post-COVID coefficient of variation values are lesser than pre-COVID coefficient of variation values. Therefore, there is a consistency in the perception of HROD professionals on the effectiveness of implementation of HROD interventions. Since coefficient of variation of post-COVID-19 is less than that of pre-COVID-19 for all attributes of each of the parameters that I mentioned: managing people, recruitment, performance management, training and development, appraisal and reward, and organizational exit, it indicates that the perception of HROD professionals regarding the effectiveness of the HR processes is consistent in post-COVID-19 than in pre-COVID-19. So the hypothesis that there is no significant difference between the perception of HROD professionals towards the effectiveness in the process of performance management, which I told you, in pre and post COVID, was accepted based on strong, significant results of the t-test, which was at 0.05 level. So in pre-post scenario, greater mean was observed. In pre-COVID scenario, greater mean was observed and was compared to the pre-time as compared to the pre-time frame with a lower standard deviation, justifying that there is uniformity among the respondents. Performance management process has to continue to address important aspects such as goal setting, performance plans and targets, career paths, identifications of KPAs, key performance areas, identification of high performers and high potentials, and inter-role linkage in post-COVID-19. So the post-COVID-19 implementation in this area needs to be closely monitored in a systematic manner with transformational tools. And coming to the retention of staff, the null hypothesis was not accepted with a p-value of 0.001. It is observed that the mean score of retention of staff is found to be of a higher value during post-COVID than pre-COVID-19. Further, the standard deviation of attributes is lesser than that of pre-COVID-19. This means that the HROD process are more consistent in post-COVID than in pre-COVID as perceived by the HROD professionals towards the effectiveness in retention of staff. Now, this inference is supported by the coefficient of variation regarding the items in the process of retention of staff. Now, next, my study was about employee-centric sustainable hospital services. So, under the null hypothesis, there is no significant difference in the perception of HROD professionals towards employee-centric sustainable hospital services in pre and post COVID-19. The hypothesis was not accepted, null hypothesis was not accepted with a p-value of 0.001. So what were the different sub-hypotheses that I looked in here? I looked into employee-centric human sustainability, employee-centric social sustainability, employee-centric environment sustainability, and employee-centric economic sustainability. 4 of these sub-hypotheses were tested. In 3 of them, The null hypothesis came as not accepted in case of human sustainability, in case of social sustainability and environment sustainability. But in case of economic sustainability, the null hypothesis sure was accepted with p-value of 0.07, much higher than 0.05. So the descriptive statistics gave us this inference, and it is yeah, observed that there exists, I told you, significant difference in employee centric human sustainability in hospital services, which means that attention was paid to education, health, nutrition, and employee well being. In terms of social sustainability, there also it is observed that there exists significant difference because attention was paid to policy decisions pertaining to equality, inclusivity, rights, respect for staff and patients, enhancing interpersonal relationship amongst the different levels of hospital staff, team culture, and exposure to knowledge of global practices. Even in terms of environmental sustainability, it was observed that there exists significant difference, indicating that HROD professionals' involvement in implementing green HRM practices and initiating interventions for human welfare was undertaken. Then, which was that odd man out? It was with respect to employee-centric economic sustainability. Here it was observed that there is no significant difference, both in post and pre-COVID scenarios. Now, addressing this challenge by HROD professionals is key as the employees believe that despite risking their lives and being committed and involved, they do not get their dues proportionately in terms of monetary gains, though they may be receiving appreciation and recognition which is non-monetary. The employee perceived lack of gain sharing and achievement motivation. The compensation, which is an important component of economic sustainability, remained at the same level with no additional incentives in post-COVID-19. Their expectation of gratification continued in the post-COVID-19, which became the reason for growing strong dissatisfaction. Then let me come to the fifth objective, that is to examine transformational interventions undertaken by private hospitals during the post-COVID-19. Now, here the factor analysis was being administered on about 112 items. After principal component analysis, 14 important variables, which I call them as transformational interventions, were being identified. Let me tell you what they are. The first is transformational organizational cultural interventions, followed by individual development interventions, communication process interventions, wellness and value-based interventions, learning and behavioral interventions, organic structural interventions, employee engagement interventions, team building interventions, patient experience interventions, outcome-based interventions, job enrichment interventions, administrative interventions, flexible working interventions, and conflict resolution interventions. Now, so the 112 items were being classified into these 14 interventions. The result of which said that there is a significant positive transformational role that is played by HR and OD professionals in implementing organizational culture interventions, communication process interventions, wellness and value-based interventions, organic structural interventions, employee engagement interventions, team building interventions, patient experience interventions, outcome-based interventions, job enrichment interventions, administrative interventions, flexible working interventions, and conflict resolution interventions during post-COVID-19 than in the pre-COVID-19. The reasons for non-acceptance of the above null hypothesis are the adaptation of strategies in the following vital areas of human resources. Employee wellness is managed through provision of wellness program for employees with better and safe working conditions, health benefits and flexibility when it comes to employee health issues, gestures of employee appreciation, training safety training, participation and adaptation in health and safety compliance, enhancing team spirit, mutual understanding, cooperation, and attention to employee welfare. Now, these were given to reduce a sense of insecurity and improving their morale. Relationship-oriented systems are designed to create belongings. Further, flexible work arrangements provide flexibility in working opportunities, enabling agility and work-life balance. Attention is paid to employee-friendly processes with flexible arrangements in work location, work hours, and work condition through employee-centered practices, including desirable approaches such as leave facilities, flexible working schedules, while designing the policy for building flexi work culture. The new technology implementation by imparting guidelines and regulations for use of new technology. To overcome, they also work to overcome human capital loss. Attention was paid to hospital staff's wellness, multiple job role participation, human capital skill preparation, and promotion, development, promotion, voluntary initiative, rekindling culture and atmosphere of pre-pandemic days. HRD interventions were provided as an exposure to transformational initiatives, training advancement opportunities, and learning sessions to ensure productivity to some extent, even during the pre-COVID, but greater in the post-COVID. Leadership strategies to support employees with genuine interest in the overall well-being of employees. Ongoing communication on HR policies related to crisis through health talks and training sessions. Performance enhancement was ensured through timely guidance using digital surveillance tools and by redesigning performance goals and performance evaluation. Internal communication was restricted to compliance with government rules and regulations, celebrating successful accomplishment of short-term goals. Remote work tools were being used to allow doctors to provide service through video conferencing, remote stethoscoping, etc. Now, although there is a transformational role played by HROD
Ma'am, finish the section.
Madam, it was in the last stage, madam. We lost connectivity, madam.
Okay, ma'am. Okay.
Another last one point was remaining. We lost the connectivity, madam.
Okay, ma'am.
Yes, ma'am.
Ma'am, Aisha Sharif, ma'am.
Yes, please. Hello.
Madam, we lost connectivity, madam.
Unmuted, ma'am. Your voice is. Hello. Ma'am?
Are you able to hear me?
Yes, ma'am. Yes,
yes,
ma'am.
ma'am.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
So, did you not hear me throughout my presentation? I can't hear you. Madam, you must unmute.
Now it's started
5 minutes, ma'am. Yes, ma'am. Last point you were telling something, madam. Um,
I'm
in
sorry.
the transformation interventions, you told all the findings. You are trying to conclude, madam. We couldn't hear, madam. For around
Was
two,
it,
three
sir?
minutes.
Was it,
Yes,
sir?
ma'am. Yes.
Yeah. So
Yes.
only in terms of individual development interventions and learning behavioral interventions, you know, people were not happy. The staff always had complaints with respect to law, only two of those various transformational interventions. Well, they were pretty much satisfied with the implementation of all other OD interventions. Only with respect to the learning and behavioral interventions as well as individual development interventions, they had a lot of reservation. Reason being that, they felt that the e-spark and the employee expectation towards personal development were not robust enough. It was not intensified. Private hospitals were used centralized authority with close control over supervision, which made the staff, rather, there was restriction on the staff in terms of the creativity. And finally, the custodial orientation inhibited their learning and innovation due to lack of freedom and low tolerance for mistake. So these were the reasons why people were not happy with these two interventions. But otherwise, in all other cases, it was the null hypothesis was not accepted. Only in these two cases, null hypothesis was accepted. So what I said was I have another session in the afternoon where I have